I'm Jim Heath. I'm here today with Dr. Samantha Picos. Um, Something that we care a lot about at ISB is the science of women's health, and Samantha has just published a pretty exciting paper in Lancet Digital Health, and so we're going to talk about that a little bit. So Samantha, why don't you tell me a little about what you learned?
Yeah, so we were looking at the impact of maternal COVID-19 infection in unvaccinated pregnant women. And what we found is that regardless of COVID-19 infection severity, women were at increased risk for poor birth outcomes.
What do you mean by poor birth outcomes?
So we looked at a number of different outcomes, primary one being gestational age at delivery, so how long the fetus had to develop prior to birth. We also looked at preterm birth, stillbirth, low birth weight, small for gestational age, so that is the weight of the baby adjusted by the length of time that they had to develop. We also looked at other maternal related outcomes such as preeclampsia.
What was the thing that was most impacted by COVID infection?
So there was a number of things actually. Preterm birth and stillbirth were both at elevated risk following maternal COVID-19 infection, especially after first and second trimester infections.
Yeah.
And then small for gestational age was also significantly more likely to occur, especially following a third trimester infection.
So this means it actually matters when the mother is infected during the course of the pregnancy?
Exactly, yeah, that's what the trends seem to suggest. And I mean, it makes sense because different developmental events are going on at different points in pregnancy. For example, most of the growth happens in the third trimester, so it makes sense if there's a stress event that the baby might be smaller.
And so I know that you all have access to, well, a lot of records. How many women did you study?
So we looked at over 18,000 women that had at least one COVID-19 test during pregnancy. 882 of them tested positive while they were pregnant.
And did you find, so that's a lot of, so basically that allows you to actually say things with statistical certainty. That's a lot of patients. These women must have come from different walks of life or different geographic regions or socioeconomic backgrounds or what have you. Did you find relationships?
Yeah, that's super important to take that into account because what we saw was that women that were infected with COVID-19 during pregnancy looked very different from women that were not, and we need to take those socioeconomic, environmental factors into account if we want to make sure that we're making an apples to apples comparison and not just seeing the underlying demographics. We want to make sure that the signal we're seeing is due to the COVID-19 infection. And so we took things into account like insurance status, so whether a woman was on Medicaid as a proxy for low income. We're also able to pull environmental factors such as smoking status and pre-existing conditions like diabetes. And what we did was we matched women that were infected with COVID to women that were not on these similar factors, and then controlled for all of those cofactors. So
right.
Yeah.
So if, obviously I'm not a mother, that's not going to happen. But I could imagine if I was a mother, I'd be in general scared of all things COVID, probably including vaccines as well. And did you find an impact on vaccination in terms of pregnancy and complications?
In this study, we didn't look at vaccination. All women in our study were unvaccinated, but what the CDC, the WHO, all recommend that women get vaccinated because it protects both mom and baby. What we're seeing is that no matter the severity of infection, that women are at increased risk for negative birth outcomes. And that's something that is real, that is a signal.
So basically your bottom line suggestion to women out there is that if you do intend to get pregnant, you need to be vaccinated.
Yeah, if you're intending to get pregnant or currently pregnant,
Right, or currently pregnant.
it's recommended that you get vaccinated, and that protects both your health and your developing baby.
Wow, that's very important. So what's next?
Yeah, I mean, next is we're definitely looking at vaccination, status
Yeah.
on birth outcomes. We're also responding as the pandemic continues to evolve, looking
Right.
at the impact of Delta as well as breakthrough infections. So
Right.
we want to continue to stay current and address these questions as soon as possible so women have all the information that they need to make informed decisions about their health.
So is there any piece of information or piece of guidance from your study that we haven't covered that you think is critical?
Yeah, so for any woman that had a COVID-19 infection or think they might have had a COVID-19 infection while they were pregnant should tell their doctor.
Yeah.